Welcome to another episode of Let's Talk Small Data with T, where we are passionate about the power of small data in healthcare. I am your host, Tanazia Gonzalez, but you can call me T. Data has certainly changed the game in healthcare. Big data has blown the roof off, but small data, now that's the future. Small data allows us to dive deep into the key insights and take quick, customized action to achieve phenomenal results in performance and quality improvement. Let's explore this today. Thanks so much for joining us. If you have any questions for me or any of my guests, feel free to reach out to me at tgonzalez@eima-inc.com. Enjoy the show. Let's go. In Season 4, our topic is healthcare data analytics as a career. I spoke with some folks who are new to the field or thinking about joining in. I also spoke with some seasoned professionals and learned from their insights and suggestions for those who are beginners. I hope you find these conversations as enjoyable and informative as I did. More importantly, I hope they help you in your journey. I am so happy to end Season 4 with my conversation with Doug Laney. He is someone I truly admire. Doug is an advisor, he's a speaker, he's a best-selling author, and he's an instructor. And I had the honor of meeting Doug at the Data Universe conference earlier this year. Doug is a data analytics strategy innovation fellow at West Monroe Partners, where he consults to business data and analytics leaders on conceiving and implementing new data-driven value streams. He is the author of Infonomics, How to Monetize, Manage, and Measure Information as an Asset for Competitive Advantage. He's also the author of Data Juice, 101 Stories of How Organizations Are Squeezing Value from Available Data Assets. In this talk, Doug emphasizes that data, when treated as a valuable asset rather than a byproduct, can drive immense value for organizations. He discusses data's unique qualities, its ability to be used repeatedly without depletion and to generate more data can transform businesses, especially when leveraged strategically through innovative technologies and proper asset management. Doug advocates for organizations to move beyond just reporting and compliance and instead focus on using data to generate actionable insights that improve outcomes and create new value streams. He's the originator of the 3 V's of big data: volume, velocity, and variety. These are core aspects of big data, and you'll learn more about this in this talk. I hope you enjoyed this conversation as much as I did. More importantly, I hope you get from it something that helps you along your journey. Thank
I'm
you.
honored to be with you. Thank you. So Infonomics is this concept, more of a kind of a term that I came up with 25 years ago while I was at Gartner. So I was a long-time Gartner senior analyst.
Nice.
And,
Okay.
around the turn of the millennium, we started thinking more about data as an actual asset. Certainly in the early days of what people were talking about, big data, right? I know this podcast is about small data, so I won't belabor big data. So back in like 1999, I came up with this definition of big data being data that's high volume, high velocity, and high variety. So the 3 V's of big data are attributable to me back years ago. I know other people have tried to add other V's onto that, like, I don't know, velociraptor and value, and I don't know, whatever else, veracity. But what's interesting is like none of those apply to data's bigness. They're not measures of magnitude. They're kind of measures of all data. So not really valid definitionally when it comes to big data. But anyway.
What are the 4 V's?
The 3 V's are
3 V's.
Are volume, velocity, and variety.
There you go.
So they are measures of magnitude or indicators of magnitude of data's bigness. And so we realized back decades ago that it wasn't just the size of data that was challenging
Mhm.
organizations, it was also the speed at which data was being generated and collected,
Mhm.
especially
Mhm.
in the early days of e-commerce. And then that the variety of data was getting broader. We were starting to collect data and generate data on all variety of business functions, whether they're financial
Okay.
functions or operational functions or HR or whatever. Um,
Okay.
and that was challenging for organizations because they now had a greater variety of data. Um, so
Right.
that's where the big data kind of comes from. But
Right.
after that point, I started thinking more in kind of business terms, which is all right. So now we have all this data. What are we doing with it? And
Right.
the questions while I was at Gartner back then turned to what is big data to what how do we do big data? So how do we architect those things? What kinds of technologies do we need? And then the questions turn to, all right, what do we do with all of this big data?
Mhm.
So um, I started collecting use cases on how organizations are using data in innovative and high value ways, not just to generate pie charts and bar charts and
Right.
dashboards,
Right.
but really you put data to work.
Right. And
Uh,
that's the whole point of collecting it, harnessing it, cleaning
yes,
it, crafting it, making sure there's integrity because we want to take action with it, right?
absolutely.
For some end purpose in mind. And
Yeah,
so,
unfortunately, a lot of organizations still just want to report on it, want to generate reports, hindsight-oriented reports. We refer to that as descriptive analytics,
yeah.
which
Mhm.
is not there's not really a value proposition there other than satiating the needs of executives, right?
Mhm. Yeah.
Which isn't nothing, but still. And then there's compliance reporting that, of course, is
Yeah.
requisite. Um, but we started thinking about that and came up with this model of thinking about the different kinds of ways that data can generate value.
Hmm.
Beyond that, which is we can use it to diagnose things, we can use data to predict things, and then we can use data to prescribe things. So that
Yes.
diagnostic,
Yes.
predictive, and prescriptive model, you've probably
Descriptive.
seen a lot
Yeah.
that comes from Gartner. And then increasingly, we're thinking about how to use data to automate or digitalize things as
Yes.
well. And so that gets into the world of AI and digital technology and so forth. Um,
Totally. There's
yeah,
some
so
beautiful things that can be done with it. Have you guys ever worked with healthcare organizations?
for sure, yeah. I didn't really introduce myself or my firm, but I'm with a firm called West Monroe now, and West Monroe
Exactly.
is
Well, wait a minute. Let's take a break and like
all right,
back up about 100 steps.
all right,
Do a quick introduction.
sure,
Like who are you? Where are you? Where are you in this world? And like what's your main focus in life
right,
here
all
and
right, cool.
other things you want to
So based here in Chicago for now,
nice.
and with a company called West Monroe. I've been here about
Okay.
4 years after leaving Gartner.
Okay.
And West Monroe is a consultancy based in Chicago that is focused on most industries and has a technology
Mhm.
practice, which includes a data and analytics competency. And
Nice.
so they brought me on as a what's called an innovation fellow for data and analytics strategy. So
Okay.
my role is to increase or grow the capabilities around data and analytics for our firm, our consulting offerings, and
Hmm.
then bring innovation to our clients as well. And so
Nice.
most of that innovation is around how they can use data to
Hmm.
drive new value streams. And that's really
Love it.
kind of getting back to
Love it.
infonomics is really kind of the core of infonomics. Um,
Right.
so after we talked about big data, um,
Yes.
and after kind of that time, we started thinking about data as an actual asset and all that that entails. Now, what
Hmm.
happened to really spur this was the 9/11 terror attacks.
Mm.
And after
Okay.
that time, some clients started contacting us at Gartner, lamenting not only the tragic loss of life, but also the loss of their
Hmm.
data. Right. So this is in the days before
Yes.
offsite
Yeah.
backups
Clouds and all of that. Hmm.
and cloud and all that. So companies actually lost their data. Uh,
Wow.
became a real existential event for some companies.
Interesting.
They lost their customer records, they lost their legal documents, they lost their um, you
All
know
the history, all the legacy information.
transaction history,
Hmm.
everything, right? And so so some of the companies reached out to us at Gartner because we had done some early work on valuing data, on
Right.
measuring data's value. And they said, hey, can you help us value our data because we want to submit claims to the insurance companies
Hmm.
for the value of the data we lost. So we helped them do that. And the insurance companies came back and said, sorry, we don't consider data to be property, therefore it's not
Wow. Hmm.
covered by your property and casualty policies. And I was like, oh,
Yeah.
seriously? Like, how is data not an asset? So I looked up, cracked open my accounting books, and
Uh-huh.
what is an asset? Well, an asset is something that is um, owned and or controlled. Okay, so
Hmm.
that fits for data. It's
Yeah.
something that is generates um, probable future economic benefits and
Hmm.
something that
Hmm.
can be exchanged for
Hmm.
cash.
Hello.
Data
Hmm.
clearly meets those criteria, just that the accounting profession hadn't come around to really acknowledging that. And so the insurance company said, well, hey, if the accounting profession is not recognizing data as an asset, then we're not going to recognize it as property. So there were a number of court cases that ensued, and the courts are thoroughly confused on the matter even today as to whether data constitutes property. Um, some courts have landed, issued rulings in cases where data has been misused
Right.
or stolen or whatever. Um, they've issued rulings that data should be considered property because it can
Mhm.
be represented physically by bubbles on an optical disc
Right.
or whatever, and other or can be printed. And other courts have ruled, well, one court in particular ruled that data should not be considered property because, catch this, because electrons have negligible mass.
What?
Yeah. So that's the kind of crazy world we live in. So then what the accounting profession did was, well, said, hey, first the insurance industry said, hey, we're a bit exposed here because our property and casualty policies are not explicit about
Yeah.
whether data is property or not. So they updated the commercial general liability policy
Hmm.
template.
Hmm.
Um, the insurance service body in the US did this,
Hmm.
updated that template to explicitly exclude
Hmm.
data from P&C policies. When did they do that? They did that a month after 9/11.
Wow.
Yeah.
I mean,
And the accounting profession,
unfortunately, it sometimes takes a disaster and many
yeah,
casualties for us to move forward here.
yeah. I
And
mean, not to diminish the loss of life, of course,
yeah,
but a lot of people don't think about what happened with data.
yeah, I've never even heard of
Yeah,
that.
yeah.
That you taught me something with that, but
So
that it's mind-boggling that they
it
had no
is,
backup
right?
somewhere off-site, So,
So yeah, a lot of companies just didn't. And even if they had a backup, it may have been monthly, and so they didn't have any records for the
right.
last, weeks or whatever. So what the accounting profession
Mhm.
realized that um, they said, hey, if the accounting, if the insurance industry is not going to recognize data as property and the courts are
Mhm.
confused as to whether property law should apply to data, then we're not going to recognize it as an asset. And so now,
Mhm.
even if you wanted to include the value of your company's data on the balance sheet, you now no longer can, according to GAAP and IFRS. Um, and
Okay.
and so, while most organizations, especially in the healthcare field, are trying to move forward and treat data as an actual asset, the keepers of the definition of what constitutes an asset and what constitutes property have
Mhm.
doubled down on their antiquated and arcane notions that it's neither. So, yeah, there
Yes.
was even a
Yeah.
hearing, a U.S. Senate hearing on how to evolve a 1930 style accounting system into the
Mhm.
21st century,
Mhm.
where they discussed how do we like the greatest source of value in the economy today, data isn't something that we um, can't measure, right? It's not part of the GDP, it's not part of accounting,
Mhm.
yet it's at the crux of the economy today. A
Right.
lot of people talk about data being the new oil, right?
Yeah.
And well, I certainly think that reflects an appreciation that data has value and is a driver of the economy today, right?
Yeah.
This
Yeah.
is the point, that data has really unique attributes. And so we'll get into that
Right.
in a moment, hold that thought. But the hearing got into, data is a driver of the economy. Uh, there's the lack of transparency into what businesses are doing with data. So it's creating undue market volatility.
Yeah.
And because it was a US Senate hearing, you can imagine what the outcome of that was.
Hmm. Okay. Interesting.
So that's where we are today. But back to the oil analogy, you know, it, yeah, at a macro level, of course, data is a driver of the economy like oil is, but it misses the point that data has these unique attributes. Like when you consume a drop of oil, what happens, right? It creates heat, energy, pollutants, and then
Right.
dissipates, right? When
Kind of.
you
Mhm.
create, when you consume oil, it doesn't. You can only consume it one way at a time, right? So you've got a
Mhm. Mhm.
barrel of oil, you've got a drop of oil. You can only consume it one way at
Mhm.
a time, and then
Mhm.
it's gone. And that when you consume oil, it doesn't create more oil, right? Now
Right, right, right.
think about those things in terms of data. With data, we can consume data. It doesn't deplete, right?
Mhm.
We can consume it over and over again. We can
Mhm.
consume the same data multiple ways
Mhm.
simultaneously and should in order to
Mhm.
drive more value from it. And third is that typically when we consume data, we're generating more data, right? So we're using
Yeah.
data through some process like inventory reordering or customer sales or whatever. We're generating data from that activity that then itself is valuable. So there's a little bit of a flywheel effect there
Mhm.
if we're architected right and if we've modeled our business
Mhm.
to actually treat data as an asset.
Mhm.
So I think the companies that get this, the companies
Mhm.
that are building their business models or
Mhm.
parts of their business models based on these unique, taking advantage of these unique characteristics of data, are the
Mhm.
ones that are really thriving today.
Um, yeah, no, thank you for that. I mean,
Yeah,
so my love and heart is in healthcare and
yeah,
really serving
hmm,
human beings and really diving into the big data that the healthcare
hmm,
industry creates every day,
yeah,
all day long, every minute of the day, through all the hospitals,
hmm,
creating loads of data, all the physicians
hmm,
seeing patients, creating services, creating all these data. And pulling it all together and like looking at all that bigness of all that data through the claims, through the EHR or the electronic
hmm,
health record systems, creating
yeah,
stuff. How do we take all of that big data and
hmm,
dive in and
hmm,
really work with the small data to really track and monitor what's happening with the population or the individual? Like in my industry in healthcare, like data is really
hmm,
valuable
yeah,
because it will tell us who needs to get a call right
hmm,
now to prevent suicide, who is
yep.
at risk for going back to the hospital to be
Mhm.
readmitted for the same thing they had last month, who
That
is
makes
at
sense for
risk.
hospitals. Readmission is under
Yes,
Obamacare. It's a big expense if you have
yeah.
readmission within a certain amount of time.
And what a waste.
Hmm.
How do we remove the waste from our system? Where
Yeah.
exactly do we need to focus
Hmm.
to improve this
Hmm.
care, these services that we're providing?
Hmm.
So that's where my real love is and why I've started this podcast to talk to other folks about how and what they're creating to be
Hmm.
able to really leverage the power of the small data that we're able to get from the big data as well as create and use to identify specific
Hmm.
actions that we need to take to improve outcomes.
Yeah.
So talk about value. I mean,
Right.
myself in data, because I was able to provide some data for our HIV/AIDS population to a specific health insurance company, that resulted in like 2 million. I
Hmm.
would say in that case, definitely data is an asset because that definitely added some dollars to the
For
bottom
sure.
line. And that happens every day.
Yeah. There are so many great
Or,
stories in the healthcare world.
yeah.
When we talk about data monetization, and
Oh,
one of
yeah.
the concerns, particularly in the healthcare industry, is you can't monetize your patient data, right? Because of HIPAA and all sorts of
Yeah.
privacy regulations.
Yeah.
But I believe that that's actually narrow-sighted,
Hmm.
that you actually can monetize your patient data or customer data, even given regulations. And the way that we do this is like we're working with a hospital
Hmm.
um, out in LA who knows who its uh, knows, for example, knows who its diabetes patients are,
Hmm. Hmm.
but it can't share that data with anyone. But what it can share, we flip that model on its head. So we call this inverted data monetization. So I
Okay.
can't share my patient data with you, but what I
Hmm.
can do is I can share information about your products and services with my customers without
Okay.
ever exposing who they are. So that inverted
Mhm.
model, we create sort of a marketplace of products and services that deal with certain kinds of medical, maladies like diabetes. So
Okay.
we can introduce to those patients healthy meal plans, gym memberships,
Yeah.
at-home glucose monitoring,
Okay.
test kits, and introduce those to the patients, maybe take a cut of the action, maybe we take a referral fee for the
Mhm.
hospital, or maybe they do it just as a data for good kind of solution and a way to
Mhm.
reduce readmissions, right? So in that way, it's monetized a different
Mhm.
way. But companies who claim that they can't monetize their patient data or their customer data are really just being kind of narrow-sighted about it and not thinking creatively about the variety of ways that you actually can generate value from measurable value from those assets that are otherwise have a lot of
Mhm.
regulatory scrutiny. Right?
Right. I
So,
mean, we spend a whole lot of effort and time and resources on cybersecurity, right? And
yeah.
keeping
Mhm.
our data and information safe.
Mhm.
So monetizing and getting dollars for the data that we're creating and having is definitely
And there are all sorts of great examples of folks
early.
in the healthcare system, generating really extreme value from data. So I've been compiling these stories for years, and we run workshops for clients on how to generate value from their data. And one of the things we do is we bring ideas from other industries. So
Okay.
a lot of times clients will ask me, "Hey, Doug, what are others in my industry doing?" And my flippant response to that is, why do you want to be in second place or third place? Why don't you ad adopt and adapt ideas from other industries and be the first one in your industry to do that? So
Right.
during these workshops, we'll bring in ideas from retail and manufacturing
Mhm.
and public sector and whatever, even to look at ways to monetize data within the healthcare, for a healthcare client. So
Nice.
we've been
Where do
compiling
people
these
go
stories.
to learn more about these workshops? Can
Yeah,
folks
yeah.
sign up for those on your website or something?
I'll
Or
tell you a little bit about them. And
okay,
so in
yeah,
in
please.
these workshops,
Hmm.
um, we'll look at a few things. We'll look at one, who are the potential stakeholders, both inside
Hmm.
and outside the organization? Who could find value from your organization's data?
Hmm.
Who could find value from its insights?
Hmm.
And we look at not only your internal kind of core functions, sales, marketing, delivery, HR, whatever. But we're
Hmm.
looking at your partners and suppliers and customers or patients. How could they value from data? And then
Hmm.
beyond that, we look at the extended business ecosystem of partners, partners, suppliers, suppliers, partners, suppliers, suppliers, partners, suppliers, customers, and so forth, even out through and including industry organizations and hedge funds and anyone else who might find some of that data valuable. In fact, hedge funds are getting very interested in data lately. Um, so we look at the stakeholders, we'll look at what data assets are available and what could that data tell us if we tortured it enough. We generate hypotheses around diagnostic, predictive, and prescriptive solutions by business function.
Nice.
We'll look at various technologies and how could new and emerging technologies like AI or generative AI or
Hmm.
data science or blockchain
Yeah.
be used to drive more value from our data. We don't want to lead with technology,
Right.
but we need to recognize that these technologies open up doors for us for driving data value that didn't exist before. So we have about
Right.
7 or 8 different kinds of exercises that we go through during these workshops to generate ideas. Typically, we'll end up generating over 100 ideas in these workshops, but no company can implement 100 ideas. So we
Right.
take the feasibility process where we look at their various benefits, economic benefits, societal benefits,
Hmm.
benefits for customers,
Hmm.
benefits for reputation, et cetera. And
Hmm.
then we'll look at the challenges as well, like what are there ethical and legal challenges? Are there data related challenges like quality or lack of integration or lack of completeness in data? Are there technology challenges that would be imposed for creating this data product? So then we plot them and we say, all right, the ideas that are high value and low complexity are ones we probably want to prioritize. Those that are high value and high complexity, we probably have to build some capabilities first. Those that are lower value and low complexity might be add-ons to maybe some other ideas that we're implementing, or maybe we
Right.
defer those as well. And that those that are low value and high complexity are ones we probably want to defer, altogether or dismiss altogether. Then we go through a process of market testing the ideas. So we take a
Okay.
very much a product approach to this.
Oh,
Uh,
nice. Okay.
Reinventing the wheel. We take a new product introduction, product management approach to these ideas.
Hmm.
Um, how are we going to support them? If it's an externalized data product? How are we going to sell it? How are we going to market it? How are we
Okay.
going to integrate it into a customer partner's systems to make it that much more consumable? How are we going to package that data? Are we going to package it as raw data? Are we going to package it as some kind of analytics or
Hmm.
sub-selected data or a workspace where we're going to set up a workspace or marketplace where people can come?
Hmm.
So there's a variety of ways to package and channels to distribute data and insights that we need to think through. So we go through that whole process with clients in a matter of weeks.
You all worked with mental health and social services organizations before?
Yeah, nothing I can talk about really publicly, but
Yeah, you know,
yeah,
like,
I can share some examples that I can share publicly. One
oh,
is, you don't mind me mentioning other hospitals?
it's okay. It's
Okay.
fine. If it's okay for
um,
you to do that, we
yeah,
can do that. It's fine.
yeah, yeah. Mercy Hospital is a great example. So they wanted to reduce
Wait, are you
uns
talking about Mercy Hospital
yeah,
in Long
Mercy
Island?
Health, Mercy Health, yeah,
Mercy Health.
the
Okay, so
system.
where are
Yeah.
they located?
Sure where they're, are they Maryland? Maryland?
Oh, okay,
I
okay.
think. I'm not sure.
Because we have a Mercy here in New York, so I was like,
Yeah.
okay,
Might
um,
be. I know it's East Coast, but
okay,
so they wanted to reduce the undesirable variations in
okay,
care delivery that impact the quality and care and cost. So they use some machine intelligence software to correlate thousands of patient records
mhm,
with financial data from EMR and claim systems and mathematically sequence and aggregate the clinical procedures
yeah,
to uncover optimal clinical pathways. And
nice. Okay,
so these optimal clinical pathways increased physician adoption by 20%. They deployed the clinical pathways twice as fast, improved care and quality, reducing this clinical variation, and achieved incremental savings of over $100 million over the first few years. So
beautiful.
great story there.
Um, and like where I always focus, I know everyone's really focused on, all right, what's the ROI? What are the dollars looking at?
Yeah,
But I love to really
yeah.
look at the outcomes
Yeah.
for the patients. You know,
Hmm.
are we improving lives?
Right.
And it
Speaking of
sounds like,
outcomes,
yeah,
Boston Children's is a great example. They wanted to manage bed capacity
okay,
in their emergency departments, so they implemented some advanced analytics to predict bed availability and patient
okay,
flow, and then this helped them optimize the availability of beds, reduce wait
beautiful,
times, improve patient
nice.
flow, and so forth. Yeah.
Really making a added value, put it more added value into the experience for the
Mhm.
patient. I love that. Yeah,
Yeah.
very
Yeah.
exciting.
Kaiser
Yeah,
Permanente, great story there, where they wanted to improve patient outcomes and reduce
yeah,
hospital readmissions, like we talked about.
okay,
So they implemented some data science to identify patients at high risk of readmission, as you're talking about. And so by targeting them with tailored post-discharge care plans, Kaiser
mhm,
was able to significantly reduce readmission rates. I don't think they published that, but improve
nice.
patient
Okay.
outcomes, lower overall healthcare costs. Yeah.
Yeah, it's like you have to get really specific. You know, okay,
Yeah.
Miss Jones had this
Mhm.
episode, and
Mhm.
here's her full story. And by the way, here's her care team. Is everybody in the loop? You know,
Yeah.
so and is everyone aware of their role? Let's get this woman,
Right.
this patient to a better place.
Mhm.
So I get excited with this type of activity. So one project where actually we just got a grant for, it's called Zero Suicide, and it's about preventing suicides.
Wonderful.
So really trying to deep dive into our data to really identify those folks that may be at risk by
Yep.
way of things that have happened in the past, like
Mhm.
suicide attempts,
Mhm.
unsuccessful attempts. Obviously, that puts them on the list for high risk.
Yep.
And those things are usually coded by way of an ICD code. If you make it to the emergency room
Right.
because of that, or if you make it to the hospital,
Mhm.
but usually it's
Yeah.
things are learned through conversations, you know, with the social workers, with the
Right.
psychiatrists. So we're trying to
Mhm.
apply some NLP also
Great.
within our EHR, looking at the notes, pulling
Mhm.
out phrases and code words. I mean, it's
Mhm. Yeah, we worked
very
with the U.S.
complicated.
Army years ago. The big
Okay.
problem with the Army, especially coming out of the Gulf
Mm-hmm.
Wars,
Mm-hmm.
suicide was a big issue, and so we worked with
Yeah.
them to look at the similar kinds of things, but also actually record them during their therapy sessions. And there
Yeah.
were certain, visual cues that were not even noticeable to the therapists.
Yeah.
Um, that they picked up using, I think it was at the time was a Microsoft Connect they were using
Okay.
to record this. I'm sure they've advanced
Tone
this,
of voice
but
also, right?
tone of voice, there were little
Body posture.
movements,
Yeah.
micro movements in the face and the
Wow.
expression that were indicators that they were able to correlate toward propensity to commit suicide or attempt suicide.
Wow. That
Yeah,
is amazing.
yeah.
Yeah. Um,
So data comes from everywhere. It's not just from the written reports of the
everywhere.
clinicians, but also
Totally.
from visual capture of
Yeah.
things, analysis of
You
the.
and I are creating a lot of data right now. Just me doing like this, that's
We
creating
are,
data
we
like,
are.
wow.
Yeah.
I'm really
So
fascinated
all
with
these
it.
use cases are great, but it's only so good if you're not managing data, as an asset. So what we find is a lot of companies just, mismanage their data. They treat it as a
Right.
byproduct rather than take a real asset management
Right.
approach.
Right.
So that's
So it's like that's why I
another
always
part
say
of infonomics is
totally. Oh, okay. Like
that's
what's
the
your objective? Like be very focused on what's your main objective.
so the main objective is to make data more available and higher quality, really.
Mhm.
Yeah.
But I mean, like if I'm going into, a specific, I mean, for us in healthcare, because our
Mhm.
data systems, like we have so many different EHRs, so many different lab systems. I mean,
Mhm.
lots of, uh,
Mhm.
you know,
Right.
venues to try and bring together and augment the data
Mhm.
and turn it into something usable for AI. But if I focus on a small population,
Mhm.
very focused, very detailed, and just have very, very non-complicated with specific objectives in mind.
Mhm.
My main mission is to identify the high risk folks that are at risk for suicide
Yeah.
and take specific evidence-based protocols, apply those to prevent suicides,
Mhm.
and I'm only doing it within my population, not a much larger population. So I think it works better that way.
Yeah.
All right. So thank you for that deep dive.
Great. And then there's the measurement aspect. So not just managing data as an actual
Yeah.
asset by applying
Yeah.
classic asset management practices to data, but also measuring it. What is the cost basis of data? If we're going to treat it like an asset, we need to understand what's the cost basis of our data. What
Yeah.
does it cost us to acquire, store, secure,
Mhm.
govern
Exactly.
that data? And then what is the value proposition on top of that? So think about it like an equation. We've got the
Mhm.
denominator, which is the cost of data. And we've
Mhm.
got the numerator, which is all the ways that we're generating value from data. And again, because data is this non-rivalrous, non-depleting asset, we can use it multiple ways simultaneously
Mhm.
and increase that denominator almost infinitely, right?
Mhm.
Uh,
Mhm. Mhm.
and the more that we do that, we generate more margin or profit on that data.
Right.
And
Right.
our goal with any client is to help turn their data management or even their IT function from a
Mhm.
cost center into a profit center.
Okay. Interesting. Interesting.
So
Well, yeah, no, very interesting stuff. So is all of this information and the definitions that we've gone over that's in your book, Infonomics?
right. And then the use case examples that we've compiled
Mhm.
over the years are in the
Yeah.
Data Juice book.
Yeah.
So if any of your
Okay.
listeners want to reach out to me for signed copies,
Nice.
um, you'll let them know how to reach me
Yeah,
via
for sure. I've got
email
mine.
or
Thank you for
LinkedIn.
that. I'm gonna
Yeah,
keep squeezing that juice.
you bet.
But
Yeah. So
Doug,
that Data Juice book is meant to inspire or shame organizations into more with their data. So
definitely. And healthcare has been slowly coming to the table to really value data, as its own business entity, which I'm really enjoying watching come about.
great, great. You're doing
So
great work yourself. Really
thank
appreciate
you.
it.
Well, Doug, thank you so much for joining me today.
Anytime,
Uh,
anytime.
and folks may want to reach out to you after they see this. What's the best way to contact you?
Connect with me on LinkedIn is probably a good start, and then
Okay.
we'll share credentials from there.
Nice, nice. All right. Well, thank
Sure.
you so much.
All right. Thanks, T. Be
All
well.
right.